your patient. And if every time them come and see tears at the eye corner that run down and it just dry up, or the patient is not eating but the mouth just full of white stuff, they can hardly open their mouth, you can hardly stem teeth because there's so many white stuff there. Like, it's a big turn off for me as a nurse. It is a very big turn off. And then now to think of it that the patient is incontinent, how can you as a nurse sit down and see a patient and do that? But just think of it as a situation where, you know, you go on for your regular shift. I used to work on the medical floor, and I used to work with some wonderful nurses. We call them enrolled nurse assistants or enrolled nurses. We work with your techs or your ward assistants, and we have, you know, your supervisors that comes around. And at that time, we had a floor that probably had, I'm going to say 30 to 40 patients. I'm going to put it at 40 patients. It can be more, it can be less. And we had patients who were super sick. And when you talk about patients who are super sick, they're not able to do much for themselves. These patients are bedridden. They have like sores, wounds, ulcers, you know, and these ulcers are not being taken care of by like a home health nurse or anybody before coming. And I remember working on those floors, and it's just two nurses and 40 patients. And the nurses have to do the dressings on that floor. The nurses have to do the medications for that floor. And if you're not a team player, when you come on to working in Jamaica, you're not going to work out for you, because you're going to be on your own. And you can't be on your own working in Jamaica as a nurse, because the system doesn't allow that. It allows you to be a team player. So if you and your colleague not, you know, clinging together, then dog name is supper. It's going to be a headache working on that shift, because it's like you're going to have half of the patient and the other nurse is going to have half. So it's going to be half and half. And you don't want that. You want things to run smoothly on your floor. So you're going to ensure that you work together as a team. You have to still be engaged in your ward round. You have to still be engaged in taking care of those patients who have, you know, become incontinent of feces and urine. You have to clean them up. You have to go ahead and medicate all of those patients. You understand? And you have patients that you have to feed. You have patients that you have to put in your NG tube on. You have patients that you have to be putting your catheter on. So there were so many things that the responsibility was left up to the nurse to do. And yes, the nurses are doing all of the above, but then you have to go and sit down and do the paper charting. And the paper charting is, you know, sometimes you chart by exception, but what you really want to chart, you can't chart it, because when you look at it, you have like piles of dockets that you have to sit down and write in. And can you imagine doing all of that work and then to be doing every hourly charting? You can't do every hourly charting like you do in the US here. You cannot even do rounding, because by the time you're supposed to start the medication, 4 hours done out of your day already, because there's so many things you're doing in the meantime. It is a lot of work that the nurses there do, and a lot of times people don't really see it, they don't understand it. They just feel like, say, oh, the nurses are just walking in their nice little uniform, you know, and not doing anything. And yes, persons can have their opinion about certain things, you know, but when nurses are doing their duty, people don't really understand anything about it. They don't understand anything about it. You know, when you have a patient that goes on the floor and you have 40 patients there and it's only 2 nurses and you have to be calling the doctor to come down and help you, you have to still go ahead and start run that code. And it's not a case you can take up the phone and call and say you need rapid response, or you're calling a code blue. No, you can't call no code blue, because we don't have none of them stuff there down there. You understand? You don't have any of those. You just have to ensure that you one over there and God is pumping that chest. You have to go ahead and ensure that whatever you can do as a nurse, you do it. Whatever you were trained to do, you do it. You go ahead, put in your IVs, you get some IV fluids, and you start resuscitate the patient, because that is what you were trained to do. But you see, because you don't have the extra hand, it makes it so difficult sometimes for you to do that. And when you have a patient that codes on your floor, remember you only have 2 nurses. Sometimes the other nurses from over the other side will come help you. But then remember, say you have visitation at go on same time. So how are you even doing crowd control? You cannot even do crowd control at that time, because everybody is just being inquisitive, wanting to know what's going on. And it's not a case where these patients are in individual rooms. No, they're partitioned by, you know, cloth. They're partitioned by screens. That is the privacy that you have. And when you have, you know, a floor that's supposed to have 10 or 20 patients now being housed with 40 patients. There is no privacy or little privacy. The patients are not complaining that bad, because they're getting the care that they're supposed to be getting. They're getting their medications, they're getting their food, they might get changed whenever they can get changed, but they're not complaining. But when it come on to, trying to do your resuscitations, when you come on to getting your emergency supplies, sometimes it's difficult for that to be done. You want an EKG, you only have 2 EKG machines in the entire hospital. You understand? At least, well, outside of probably in ICU, where you probably have one that one probably don't leave, but you have one in the emergency room and you have one in the EKG room. If you're not in the situation and you don't understand, then this is what happens sometimes, and I'm not here trying to defend nurses and how they're behaving, but it's just the reality of the situation. Like, there's so much you can only do with so little, but then you have so many patients. So when you get over here, yes, it's gonna feel so much better working here in the US, because you have a support team. You have so many persons that are making up your team. You don't have to feel as though you alone and God have to be doing resuscitation on this patient, and then over that side you have a patient still calling who don't care about the life that you're trying to revive over here. Like, no, it's gonna be a total different ball game. You can go ahead and see your patients and you feel comfortable about certain things that you're doing. You don't have to be there thinking that, oh, John Doe over that side is gonna die on your shift. No. So I just want persons to understand that nurses are not neglecting them. A stressful environment already for them, and adding more pressure to them where you have relatives cussing, everybody just cursing at you, people using expletives at you, being disrespectful at you. You're doing your duty and then people telling you how they're supposed to be doing your duty. It's just something that after a while people start just block out certain things. You start block out, and then the negativity, you try to ignore it because you don't want to get into anything with any relatives or any patient. You just want to do your thing and just go. And that is one thing I always, when it comes on to me working with my patients in the emergency room, on the floor, when it comes on to patients being disrespectful to me as a professional, I just dismiss myself from that situation, because the last thing you want to do is be in a situation where they're being disrespectful and then something happens. You have to always think about the negative. You have to always think about the negative, because if you don't think about it, that's where you get you get the blunt of everything. Because can you imagine somebody being disrespectful to you and then you continue taking care of that patient? You didn't excuse yourself from that environment, and then something happens, even if it is of natural cause, that patient died. It is going to be said that it's this nurse, it's a nurse over there that did something, put something in the medication. And you don't want to be in a situation like that where people are going to be start throwing shades at you and make you feel as though you are the killer nurse, quote unquote. So when I am in situations like that where I feel as though I'm uncomfortable about something that somebody says here in the US or in Jamaica, I was working, then I just step away from the situation. In Jamaica, you can kind of give it a, so you can overlook it. But just when you come on to overseas and outside of my culture, because sometimes people don't really understand you, you don't want to misinterpret. So while I can understand back then my culture, when somebody say me no like you can still go there and you still laugh and talk with that patient, and at the end of the day everybody is smiling, going their own way. Here, no. And you hear me talk about nurses, I'm not only focusing on nurses, I'm talking about healthcare providers in general, but it's because me a nurse, me just have to talk it based on my experience and all. If somebody asks me to come and help them clean up a patient, and I go over there and see the patient in vomit, and we clean up the patient, but then the patient smell like the patient have stool, my first instinct is gonna be that let's just check the patient to make sure that the patient didn't poop. You understand? But then the nurse is gonna get uncomfortable. She never want to clean up any stool. You understand? So me pick up this entire different ball game now for this nurse now who only wanted to change the gown Now he's going to have to change diaper. Me can't walk away from certain things and leave the patient a certain way, because then you just going to look like the nasty nurse. And I don't want to be classed as a nasty nurse. I want, when my relatives or my patients come in to see their relatives, I want them to see somebody that is not going to make them feel depressed. We don't want them look depressed. We don't want them look sad. I want them to feel as though, you know, the patient, regardless of what is happening, they're getting the best care that they're getting. And so I understand a lot of times, you know, people might say, oh, no, Stacey, no, me not going to do that there. I mean, I say, no, me, we going there and go do it. Me clean up the patient. Because deep down, I cannot see a patient lying in stool and not change the patient. You can't ask me to come and change one something and then you look, the patient a total hot mess. My instinct is going to be to help you clean up that patient, to make that patient comfortable. Because nobody want to lie down in stool, nobody want to lie down in urine, you know, while you're going in there and you push up your nose like this. No, that don't make no sense. Or you put on a mask. That don't make no sense. It doesn't make any sense. I will put on my mask and everything, but my mask is on for a different reason. It's not going to be because me very lazy and don't want to take care of the patient. It's not because of, you know, me smelling my patient and don't wanting to check, so I'm going to put on a mask. No, that not working in my cabinet. You understand? So a lot of times people find it offensive that you suggest certain things and they just think that, oh no, not going to work with a nurse, you know, because when they work with a nurse, they have too much work. Yes, I was well known for that, because I like to make sure that the patients are looking good. I like to make sure that, you know, first impression lasts. That is the most important thing. Your first impression lasts. So when you go in and see a patient, your patient, and if every time them come and see tears at the eye corner that run down and it just dry up, or the patient is not eating but the mouth just full of white stuff, they can hardly open their mouth, you can hardly stem teeth because there's so many white stuff there. Like, it's a big turn off for me as a nurse. It is a very big turn off. And then now to think of it that the patient is incontinent. How can you as a nurse sit down and see a patient and do that? So those are the things that, you know, upsets me a lot when I go in and help out with nurses, when I go in and see patients that you're supposed to be taken care of and that work is not being done. So yes, sometimes we are very lazy as nurses to do what we're supposed to be doing, but at the same time, I think we do what is best at the time in the given situation under the circumstances. But you see them other time there, me not really. If you can go into a room and see a patient looking like that description I gave you, and you feel comfortable walking out of that room, I would be upset as the relative as well. And then would I say, well, you deserve no raise, and then we're going to do my review. I'm going to do the review on you as a nurse. You understand? So, you know, when I look at it and say, okay, then the care that we're giving to patients every day, patients are spending so much money for the care, but yet still we're not doing much for them, especially in these nursing homes up here. Some of these nursing homes, and it depends on the location, and it shouldn't be dependent on the location. It shouldn't be dependent on the location. Sometimes you go in some places and you are in, like, you know, top of the top kind of group home or homes, and they have a caregiver, but nobody not doing anything. The caregiver come and watch TV just to see him. Them watch the TV, them not changing the patients. They're not cleaning up the patient, not brushing the patient teeth. The diapers are not being changed frequently, or even if them change it frequently, the patients are not being cleaned up. So patients are still smelling like urine. So everywhere you go, you're gonna find nurses or caregivers or healthcare providers doing the same one thing based on what they're getting. It all boils down to money. It all boils down to the resources that they have at hand. You understand? Because if somebody have a lot of money and them pay you, you know, you want more money the next time. So guess what you're going to do? You're going to work a little bit harder and you're going to put on a big show to impress your boss. And it's the same thing with nurses or with any profession. If you have little resources and you have to stretch one pack of diaper for 2 weeks, you're going to have to make sure that that patient, the only time you change it is when they poop. Which is sad. It is sad. And so every situation that you go in, it is going to be either similar based on resources, based on culture, And so I hear when we tend to tear down only the nurses in Jamaica, because yes, nurses in Jamaica don't take care of them patient. Nurses in Jamaica, them not doing this, them not doing that. But what can you do? We can only do what we can do with the resources that we have. Unless we can buy a CT scan machine and carry it over to the hospital and put it down and say, okay, then everybody who have a stroke, we're going to come and put it over that side. We have a CT scan done in less than 10 minutes. You know, it's not a situation like that. Nurses now them have the resources there. You know, don't let them feel as though what they're doing is going unnoticed, because it's not. It's they're not being appreciated. And so you find that a lot of nurses are going to be leaving. They're going to be leaving to go other places to work, and it's because of situations like that. You know, when you come to America, the time period that you spend with a patient, every single thing is based on time, because as I say, it's a health system that that is it's money centered. You understand? It's money. So if them not seeing, you know, improvement in certain things, they're gonna get more nurses. They're gonna pay more money to get the results that they need, because at the end of the day, they want to ensure that the scores that they're gonna get, yeah, you're going to rate them as a patient, and you're going to rate them on different sections. So they want to ensure that when them send over them review, you can tell them what was good and what was bad, and they're going to improve on it, because they want to be known as the top hospital. You know, so that's just the situation. It's just the reality. This channel is supposed to kind of encourage and inspire persons. You know, you talk about your story, you talk about your journey, you compare, your contrast, you talk about the differences, so people can understand exactly what the healthcare sector is all about in Jamaica. And we're not doing it only because of, you know, we want to show off the bad side of, you know, but it's just the reality of what nurses are experiencing, why they're having the brain drain. The reality of, you know, people need to understand that we need to make money so we can pay with bills. You understand? So if opportunity do pop up, we're going to take it. And everybody going to take it and run. So it's just the reality of things. But I do hope that, you know, things will get better if they have a lot of resources down there in terms of, you know, machines and stuff to kind of help with, you know, our everyday life, making it easy. Then I know a lot of nurses will be staying in Jamaica, because the money is looking a little bit better now, and so, you know, that is a plus. People can buy a car, that is a plus. So just continue with the work that you're doing, and regardless of people showing us the bad side of what nurses are doing, then I just want us to remember that, you know, you're doing the best that you can under the given circumstance, and do not compare yourself to, or compare nursing in Jamaica to nursing in the US, because the comparison is not there. You can't compare it, because it is going to be totally off in every single aspect. You understand? When it comes on to nursing education, the good nurse, I think Jamaica has produced some wonderful nurses, and we must appreciate them. We must, you know, give them the big thumbs up whenever we see them, because they have a big heart. They have a big heart, and a lot of people probably don't see it, but we have a big heart. We work real hard. We take care of patients real hard, and you don't really see the true potential of these nurses until they get here in the US, where things are a little bit lesser in terms of stress, where they're able to show exactly what they were trained to do. Some people go in there for the passion of it, and when you're going in nursing school in Jamaica, it wasn't all about, you know, going there for the money or because it's a safe job. People go in there for the love and the passion that they have for nursing. So you'll find a lot of persons who are doing nursing in Jamaica, or back then who were doing nursing in Jamaica, it was all about a passion for nursing. That's why they went in there, and I'm sure that passion, it hasn't been, you know, gone away. The passion is still there, lingering somewhere, and just waiting for the right time to revive it. And I think that whenever they move from out a situation where it is, you know, stressful and everything that is going on that I describe, I think that's when you start seeing that persons are opening up a little bit more about the love that they have for nursing. And you know, it's just sad that we weren't able to do it in our country, where that's where you really had wanted to do it. But I do hope that you understand. Please do not bash me on this topic. Nursing in Jamaica is not bad. It's not bad. It's just because of the situation that we have there. All right, but until then, thank you so much for tuning in. I'm gonna go in and see my patient, and then from there I will, talk with you guys later. Bye.